Hi, I'm Dr. Joseph Woodduring, and today I wanted to talk about a question that I myself have been pondering lately, which is it possible for antidepressants, when taken long term in a select group of people, is it possible for it to actually make them more depressed or more anxious? Um, if you've been listening to the content on the channel, I mean, my general philosophy on antidepressants is lowest dose, least amount of time. Make sure that you're doing all of the other things that you need to do to address any upstream factors that could be causing your depression. Um, However, the reality is that that often doesn't happen for a lot of patients. They come in, they get put on a medication, and um, they may have been started on it 20 years ago when something was happened, and it just kind of got continued. And um, I think it's a bad thing. I think that when something like that happens, because I do think there is potential for actually worsening depression long term. And I'll tell you how I kind of think about this. When I think about drugs which act, which people chronically use, there is a pattern. And the pattern is when you take a kind of a CNS active medication for a long period of time, there can be groups of people that really get worse. They can get neurological damage. I mean, an obvious one to think of is something like alcohol, where people who use it chronically can develop something called Wernicke-Korsakoff syndrome, which is an irreversible neurological injury. And I know you might think, well, hang on a second, that's not really a pharmaceutical. The pharmaceuticals are probably safer. But that's not really the case, because when you look at the literature, there are a lot of like psychiatric medications that do cause neurological damage over time. And this isn't kind of fringe stuff. This is all pretty well recognized. The main one being tardive dyskinesia, which is the movement disorder, which is caused by the antipsychotic medications, which are commonly used as antidepressants as well. And the incidence, I think, is somewhere at around like 5% a year. If you're on an antipsychotic medication, 5% of the cohort per year will go on to develop something like this. So that's pretty high, given that it's irreversible damage. And so, let's keep on going through them. So we have tardive dyskinesia for the antipsychotics. Move on to the benzodiazepines. Yeah. Now we know that some people are developing something called protracted withdrawal, which is really a neurological injury. I mean, this is something that is in the label of these medications, for all of them recognized by the FDA. So again, with that class of drugs, we have a group of people who develop devastating kind of worsening in their anxiety, in their depression, in their cognition, and then also pain syndromes as well. You look at mood stabilizers, things like lithium. There is silent syndrome, which is a kind of irreversible neurotoxicity caused by lithium. And now let's go to the antidepressants, and we'll talk about PSSD, which is this post-SSRI sexual dysfunction, which now is also in the labeling for these drugs in places like Europe and Canada, where where physicians are being told to, if they read the label, to inform patients about this risk. PSSD, there's a constellation of kind of emotional blunting and, cognitive problems that go along with that. So then I kind of think, so we're coming back, that's kind of the foundation. The foundation is, there are a lot of CNS drugs out there that seem to cause neurological damage when taken long term. So then we come back to antidepressants and we say, well, is it possible that these might be making, making some people maybe even more depressed and anxious over time if there's some of this neurological damage going on? And I say, well, yes, hypothetically it seems so. If you're damaging someone to the point where they're developing permanent sexual dysfunction or sexual dysfunction lasting years, why would it only be isolated there? There's a lot of other ways that could manifest. And also, with the antidepressants, they also cause tardive dyskinesia, which is that movement disorder. So I think it would be a little bit wishful thinking just to say that, the long-term damage from these medications is solely isolated to maybe, sexual function and movement. And I think the reason why maybe potential worsening in anxiety and depression and other, things like cognition are missed is it's so easy to kind of misattribute them to the underlying condition, because with PSSD, they have genital anesthesia. It's really easy to say, hang on, that's not really something with depression. But if someone came in who had a low mood, and all of a sudden they have severe anxiety and agitation, maybe that's the depression. Maybe they've developed something else. You don't normally just say, hey, it is the drug. So it's just been something that I've been wondering lately. I mean, I think it reinforces the general advice, which I think is good advice, that, lowest dose, least amount of time possible. Please address the upstream factors and lower the risk that something like this could happen, because we treat a lot of people in this practice that have these kind of long-term consequences, and it is really disruptive to your life. So I hope this was an interesting talk. I'd love to hear your thoughts on it. Please let me know what you think in the comments below, and thank you for your time.